A lot of people these days using Botox to smooth away their wrinkles. Now we're finding out that it might also ease your headaches. Some doctors have found patients to be migraine-free for an average of 12 weeks after being injected. But researchers caution against early results, citing more studies are needed to determine which patients might be likely to benefit from Botox and why. Well, major plastic surgery, it's not just for movie stars anymore, but when does self-improvement turn into an obsession? I spoke with somebody this week who's had 15 surgeries, spending more than $83,000 to have the face and figure she's always wanted. Her doctor, who is a New York City plastic surgeon, also joined us. Nikki, I'm just curious. I read in your background that when you were a teenager, you were teased a lot about your nose, and that's sort of what started the whole thing. Is that the story?
Yes, it is.
Yeah.
I do remember that. We all know that kids can be very cruel. Mm-hmm. And I do remember one specific young man that told me that I had a fairly large nose, but he wasn't so kind.
A lot of kids get teased, though, about their looks. And I mean, was there one thing in your life beyond that that really made you say, I want to change myself?
I think with time, as time went by, that I basically knew that that was something that it really stuck with me. It's something that I looked in the mirror and I said, focused on it, and I said, I really do want to fix this.
At the time, did you say, I have to be a model and that's why I'm going to have to do this, or were you thinking of other things at that point?
No, I was not thinking of that at that moment at all.
I have to go through the list because I do have a list here, and it's called the body bill. And doctor, I'll ask you some questions now. It says that you had 4 times you had breast surgery. Why 4 times?
There is steps towards the 4 times. The first time, I was a very conservative doctor, and the second time, I got talked into doing a procedure the way I did not feel comfortable with. I didn't like the looks of it, which was on top of the muscle. So the third time, I went underneath the muscle, and then the 4th time, I did go larger.
Doctor, when somebody comes to you and says, I've had this and this done, I think I want to have more done. I mean, obviously it's good for your business to do more, but do you ever take a person aside and say, yeah, I don't think you should do any more. It's getting to be too much. Have you ever had to give that advice to a patient?
Well, if the end result is excellent, too much is not really a consideration. In Nikki's case, we started off actually just doing eyes and nose. That actually gave the most dramatic change. And everything else that we did was basically an enhancement of that already solid foundation. The little lip enhancement, slightly larger cheek implants, slightly higher eyebrows. These were very, very subtle procedures. That's why the look is so natural. So the list looks long, but the main change is actually the nose and the eyes, which are much more open and clean, and everything else was really just an enhancement of her natural features.
Right. You mentioned